Welcome back to episode 3 of Diary of a Trans Pediatrician. So today I'd like to discuss depression in more detail tonight. I thought I'd give people a view of just what it's really like to be sad and down and a lot of times. And it's such a big part of being trans. And it's a big part of being just for a lot of human beings, but a lot of part of many behavioral health or mental health illnesses. And the reason I brought it up tonight and would like to talk about it during this episode is because I'm just getting done with the weekend and I have had one of those times where I have felt more sad and down. And I thought it might be helpful to talk about it more. And the reason is because in the media and online, there's a lot of discussions about, why do we worry about treating trans folks, people with gender dysphoria. As I've discussed in previous podcasts, that is the diagnosis typically that helps people that identify as trans be able to start things like hormone therapy. That's one avenue, right? One avenue is through a diagnosis of gender dysphoria. Being transgender is not a diagnosis, right? It's just who we are. So that's a good distinction. But depression almost feels like a fact of life for many of us. And, this weekend, I was in my new place since I moved to Massachusetts, to the city of Northampton. And sometimes time alone for me can be difficult. That's often a time where I can reflect on my own feelings, where I'm at in life. A lot of times that's a common thing that I will think about. Sometimes that lack of interaction with others, the human interaction has been difficult for me at times. And traditionally, several months ago, this would be a time sometimes where I have more thoughts about hurting myself. And luckily, I've not had those thoughts recently, and I think some of the treatments for me, which have included hormone therapy and androgen blockers as a trans woman, as well as specific treatment for depression anxiety, have been very helpful. But that doesn't mean I don't experience depression. That feels a lot worse, right? There can be lots of ups and downs, waxing and waning period. That's oftentimes in medicine what we'll call it. That's very common with depression. There are certain criteria we use to diagnose depression as well. And that doesn't tell the whole story, of course. Depression and many mental health diagnoses, just fitting those into certain criteria doesn't always work. However, it can be very useful as a tool to help figure out where our patients, such as when I see teenagers or kids, what do we do from here? This is what I'm seeing on this, and what do we do kind of based on that? And it's just to have further discussion too about it. But for me, depression has often looked like many of the things that our diagnostic criteria go over. And that includes lots of interest in doing things I normally like to do, just feeling sad and down. It oftentimes affects my sleep. Oftentimes I have difficulty sleeping at night. I don't sleep as well and wake up earlier in the morning. Oftentimes I won't eat as much too. I kind of lose my appetite, and that's also common, a change of appetite of some kind, a change of sleep of some kind. Those are the most common things that are seen. I've also experienced difficulty with concentrating, and it has absolutely affected my ability to do certain things, such as even my job. Previously, that has affected my performance, and in my last job, I remember my supervisor discussing this with him at length. And this is part of the reason I knew I needed a change, right? And there's many factors that result in a change for me, a big life change, which not only resulted in a move to Massachusetts, but also changing for jobs. But the fact that I could not perform, particularly some of those administrative things associated with my previous job, that was a huge red flag for me. Now, at that time, several months ago, in my last job, I lived in the state of Iowa. I lived in the North Liberty area. And from about mid-May until the end of September, I lived in a place to myself, mainly. I did not live with my kids every day, so I would often go to an empty home, go home to an empty place, and I'd struggle with the same things that I have here, and that's with sometimes too much time to think. And that's I think when some of those depressive feelings for me would feel more immediate or more overwhelming. Now, at that time, I struggled with more feelings of hurting myself. And I think that's important to talk about too. Risk of suicide, thoughts of hurting yourself, thoughts of hurting others. Those can be associated with depression as well. As a provider, that's one thing I commonly ask kids about, particularly adolescents, if I'm concerned about depression because of that. And for me, what that looked like is, when I had feelings of hurting myself, and it usually involved thoughts of me going to a bridge or the roof of my home and either falling or jumping. And in my podcast, this is difficult to talk about. Usually, this is reserved for times with my therapist in talking about specifics of a type of plan or things I've thought of. And in the medical community, we call it a plan. That's what this is called, and kind of what I'm getting at, versus fleeting thoughts. And the difference between the two really comes down to, I had this moment where I thought about hurting myself, maybe had an image or something I thought I might do. Whereas, of course, a plan would be, I'm going to go to my roof, I'm going to jump off at this time when nobody's home, nobody's around, when nobody will see me, and I'm going to do it tomorrow, right? That's a plan. And a plan doesn't have to be that specific, of course, but that's what I'm getting at, kind of two extremes, right, between just thoughts and a plan. And, for me, what that really looked like were primarily fleeting thoughts. That's typically what I had. But I also had some moments where those thoughts were a little bit more persisting. And what I mean by that is they weren't just here and there, but they would occur more frequently. I never had a plan of any kind, but I definitely have recurring thoughts close to each other, could be multiple times a day. So why didn't I do it? Why didn't I have more thoughts of hurting myself? Didn't have a plan, those types of things. Why didn't I go through with it? And that's something that it scared me a lot. I mentioned this in a previous podcast, but it really scared me. And I think the main reason that I didn't have more thoughts of hurting myself or actually hurt myself is because I wanted to live for something. And I knew what that something was. And it was a couple of things. One was for my kids. I have 4 amazing children. Being a parent is a big responsibility. And I wanted to be there for them going forward. I wanted to see them go through those big events in their life, to be proud of them during times when they graduate, such as in high school, and all those big events. My kids are younger. Those are things that I have yet to come, and I'd like to be there for those. It's such a big thing for many of us, and it is for me as well. I think I also kept moving forward and didn't have worsening thoughts of hurting myself because of family and friends. They had been there for me, and some of these things I'm talking about today, I had discussed with them as well. So that did have some influence too. It was also helpful for me to talk to my wife at the time. Absolutely. That was a huge benefit. And of course, therapy was a huge help, as I've talked about in previous podcasts. My coworkers were very supportive of me during my times where I've been really down. In fact, my work has really been my safe haven. That's been the place where I felt the best, when I'm actually in my workplace around my coworkers in my last job, as well as my current job where I work now in Northampton. That was my safe space. That was the best place for me to be. So they helped me keep going as well, I think. But there's another factor here too. When I graduated from residency training, I remember being done and thinking, wow, I did it. I have accomplished a goal in my life that I had for a long time, and that's becoming a general pediatrician. Once that training was over and I was done and then practicing as a provider outside of that training setting, something was missing. That kind of sense of purpose in life that I feel like I had up to that point just kind of dropped out. It didn't feel like I had that anymore, that kind of drive to move forward in life. Just something wasn't there. And despite years of caring for kids of military dependents, I spent a long career in the military, including a deployment to Iraq. After that time, meeting my wife-to-be, getting married, having kids. Despite having all those things, I really struggle with this kind of sense of purpose, this idea that something was missing in my life. And it wasn't until I knew that I was trans and moved forward that I knew what that was. And I think really that sense of purpose for me is to give back to our community, to the trans community, because I want to, because it's important. And something finally clicked in my life. I had that sense of purpose I had back when I was pursuing my goal in being a general pediatrician. And that's how I feel today. And that's why I started this podcast. Because as I've said in previous episodes, our community is so important to me, but really finding a way to show that to others, to show them that we really truly are normal. So that's the reasons I think that I've been able to kind of move ahead, right? That some of those thoughts of hurting myself, even some of those depressive thoughts have really improved or haven't gotten worse. Now, to help me move forward, I've had to take some pretty dramatic steps. I moved away from my family, my 4 kids, to another state, halfway across the country, but I did not do so lightly. I did it in part for a fresh start. And going back to May of this year, I remember right after I had started wearing clothes and really presenting as myself, as Ashley, I started at the beginning of May, right before a business trip to Wisconsin, and we went on this trip. You might be thinking, wow, you're dressing as yourself the first time going on this trip. That's a lot of stuff to do all at one time and could result in me being super anxious or super down. And for others in my community, absolutely that could happen. That could have happened to me too. But when I got there, I realized, wow, this is a new place. People don't know me as my previous self, as Adam. And it was like a breath of fresh air. When I lived in Iowa, in my home there, I had difficulty leaving my house to go into the community. I lived in a small town in Iowa, and I often ran into people that I knew as Adam. And that's how they knew me previously. And in the past, that's how I presented. And a lot of those social interactions were very difficult. It's not necessarily because the interaction was hard every time or I felt like that people were avoiding me, but it was more this idea that I didn't know what to expect. I didn't know what others would think. And so I didn't know what to do in some of those social situations. Do I say hi to a family when I've seen their kids in clinic? Do I say hi to a friend who I don't know if they're okay with me transitioning? If I were to say hi, would I make a scene, quote unquote? Could it get uncomfortable for me, for the other person, for both of us? These are all things I would think about during this time. So often I just avoided talking to people at all. And as I found in not only my transition and with patients in clinic, those social interactions, those time with others, that's important for everyone. So when I didn't feel comfortable with a lot of those interactions, or for fear of those interactions happening, even if I didn't run into somebody I knew, it was still difficult to go to the store. It was still hard for fear that I would. Notice I mentioned the word fear here more than once. And as a result, oftentimes this is why I would feel most comfortable in one of two places. As I mentioned earlier, at work, I felt comfortable there. My coworkers are great, but also at home, right? So even though being at home by myself was oftentimes hard and has been hard for me as far as depression is concerned, it was still a safe place or safe space for me where I didn't have to worry about some of those interactions with others or how those might go. So in my last place I lived and in that job, I kind of felt stuck. And that's ultimately what led to a lot of the steps I've taken now to move to an area which is much more affirming. This area in Northampton has been wonderful so far, and I'm so grateful for it. My coworkers here have been amazing as well. So in some ways, it's been a wonderful thing, right? It's been a good thing. I'm in a new place. I can have a new start. I'm in a very affirming community, moving away from a place that was much more conservative in the state of Iowa to a more progressive place here in Massachusetts, particularly in this area. But of course, it was at a cost, right? My family is still in Iowa right now. And although I miss my kids dearly, every single day, at this point in my life, I truly feel like it was the best choice I could make. And of course, I talk to my kids. I get to talk with them on the phone and FaceTime with them, talk to them virtually, talk to my friends. I get to do all those things, of course, too, right? Just like I did before. But at least I have a place now where I can move forward in my life, where I feel like I have a chance to really help others in our community and at the same time help myself. I've read a lot online recently about the harm of gender affirming therapies in trans youth and concerns that others have. And although we can always do more studies, perform more research on the use of puberty blockers and hormones in trans youth, the data we currently have, what we know about those treatments for our trans youth, is that it works. It helps. Just like we see with gender-affirming therapies in adults. Now, is medicine perfect? Are there side effects associated with medications that we could use in transgender youth? Yes, absolutely there could be. Just like side effects with any medication that we give or I would prescribe a patient. That can absolutely happen. In fact, there's well-known side effects to medications that not only I prescribe, but people take over the counter that are extremely common. But I think the argument that gender-affirming therapies in kids are harmful in some way really misses the point. Really, I think what's more important is to look at the harm of not treating. As I discussed in previous podcasts, saving lives is the most important thing that we do. And I have no doubt, based on not only current literature, but based on my experience personally, as well as talking with families and seeing those kids in clinic, that what we're doing right now is right. Now, could this change over time with more research? Could we change how we practice gender-affirming hormone therapy or therapies in kids? Absolutely. But remember, this is what we do with all medications, what we do with all treatments. And remember, oftentimes for people that identify as trans, whether it's trans youth or trans adults, just people that identify as trans in general, limiting access to hormone therapy, puberty blockers, adding that additional barrier is part of what makes gender dysphoria worse. Those barriers that are placed in front of others, the way we look at those in the trans community is yet another way to show that we're not normal, right? That we're different in some way. That's what it reinforces for us. So I would say to others out there that are against certain types of gender-affirming therapies, particularly in trans youth, that we will continue to study those medications and those treatments in kids. And over time, we will adjust based on those studies. But for now, based on what we know right now, those therapies are safe and they not only help our kids lead better lives, but it helps with depression, anxiety, gender dysphoria symptoms, right? That's where that anxiety depression comes from. That's what we're helping with. And it also helps save lives. As I've said many times before, I believe that being trans represents a threat to a lot of others around us. And the reason I say that is because we have a lot larger voice now. We have many of us that have come out more than ever before, and we have come together to tell our story. And I think if this was not the case, we wouldn't have the battle we have today, particularly politically, and in our society with where trans people stand. We represent an existential threat. I think that's what it is. What I mean is we challenge people's realities of a gender binary, right? Women and men and how you're assigned at birth. That's what we're challenging. So when we challenge these beliefs, this is why discussion and communication is so important. And most importantly, as a part of this, is a willingness to listen. So I would say to others out there who don't understand our community, are not supportive, or allies out there, or people that are queer that are not trans, that have questions as well, just be willing to listen to our story. That's the most important thing. And for parents out there who have a child that identifies as trans or is gender questioning or going through this process of self-discovery, I would tell you this, that remember, the number one predictor of how kids will do during this time is support from you, right? That's the biggest predictor we have. Kids do much better when their parents are supportive. So if you have a child out there that has asked questions about their gender identity, be willing to listen, just like I talked about with the trans community as a whole. And if you have questions, remember, there are a lot of resources out there now for kids that are on this journey of determining what their gender really is. And one of those resources includes their doctor. And although all doctors are not created equal, and particularly how we view trans people, we're still here to help. And we can help answer questions too as well. So I thank you for listening to my third episode tonight. You are welcome to leave a comment on my Facebook page, Diary of a Trans Pediatrician, my website, diaryofatranspediatrician.buzzsprout.com. You can also leave a message on my YouTube channel, Ashley Brown MD, as well. Have a good night, and I'll see you next time.